I'll talk about a different kind of therapy, which is that of group therapy. In this case, instead of having a one-on-one relationship with the client and the therapist, group therapy usually employs a group of people with a similar issue, around 6 or 7 of them, and it's led by a therapist, and they lead the group through greater understanding of themselves to each other. Now, the understanding of the rationale for group therapy is that obviously everything exists in a social context, that when we are anxious, that when we're angry or have uncontrollable rage or alcoholism, it's not something that exists within us, but it's a context and related to other people in our lives, our friends, our family. And maybe there's a way that using other people you can harness the powers of groups to help improve the situation that you find yourself in yourself. So one of the benefits, the several benefits to group therapy is that, first of all, it's much cheaper because there's several people at the same time. There's more social support. People around you are there to understand and experience and give you feedback of your problems. And there's also kind of a social context you could put and understand other people's situations too. So not just do other people understand you, you get to see other people's progress and kind of match your own situation to theirs. So that's a lot of good things that come out of group therapy. Another kind of therapy related to groups is that of family therapy. This is the idea that when someone has a psychological issue, a disorder, sometimes it affects the people in their lives. Other times it actually is exacerbated or caused by people in your lives. So that if you have depression and you have a family that's not supportive, for example, then changing your depression is only part of the solution. The other part is changing the situation. How do you make your family more supportive? So in family therapy, the therapist would usually bring in other people in the client's life, for example, their spouse, their family, their children, and getting a much better holistic look at what is affecting the client, what are some of the causes, and what are some of the ways that the family interacts, for example, and what are ways that the family could change the behavior to inspire better responses from the client. Right? So in that case, the people related to the cause of the situation, or people who are affected by the situation, are brought in and they discuss the situation with the client at the same time. Right? So you can imagine a situation where, suppose you have kids, and your kids is acting in a way that is not supportive and it's really affecting you. So bringing the kid to the therapist is only part of the solution. What might be useful is if you also sit in and give the child feedback to why your life is also impacted by their behavior, right? So they understand how you as a family member are also affected by their unruly behavior, right? So again, that's another way family therapy helps, is that not just only changes the situation, it gives you group feedback, but also it lets you experience your impact on other people in your life and your family around you. Finally, the last group we'll talk about in terms of group therapy is that of just self-help groups. And these are people who have similar kind of issues that kind of come together and discuss it, except in this case there's no leading therapist. And most likely you've heard of Alcoholics Anonymous, which is one of the pioneers of self-help groups, where they get people who are addicted to alcohol, who have alcoholism, and they come together and they discuss ways to stop their alcohol abuse. In addition, they give support to each other. If they stop drinking alcohol, they abstain from alcohol, they're given praise and congratulations and social support. The main function of self-help groups is that usually they help clients go through a stigmatizing kind of disease. For example, issues like bulimia or drug addiction, self-addiction, sex addiction, what else I have here? And other kinds of more unique struggles come together and they discuss the issue together. In that case, you kind of get the idea that you're not the only one suffering through whatever it is you're suffering through alone. You create another kind of interpersonal context to help you survive better and to adapt better to the situation. Right? So we see a lot of self-help groups, for example, on the internet. People have forums where people with similar issues talk about their experiences and their strategies to curbing and changing and helping themselves. Right? So these are just another idea of that instead of the one-on-one therapist we talked about, in the Freudian, in the humanistic, behavioral, and cognitive, there's also group therapies where having other people around experiencing the same things gives you a better understanding on the situation.